So the theme of ACTRIMS this year has been networks in MS. And what has been truly unique about this meeting has been the collaboration of basic scientists and clinician researchers being able to meet and network, really to review what is cutting-edge research in the MS field at a more basic science level and how we can translate that to the bedside. It's been a very exciting time in the MS field. We have a large and continually expanding pharmacopoeia in the MS space. And while we have demonstrated that early highly effective therapies in multiple sclerosis are key to forestalling early inflammatory disease activity that later prevents progression and disability accumulation later on, there's still quite a knowledge gap in terms of how we treat non-lesional activity, which is essentially progressive multiple sclerosis without active inflammation that manifests as either contrast-enhancing lesions or clinical relapses. And there has been a lot of efforts both at the basic science level and in clinical trials in order to identify proper antigenic targets that will be able to help us treat this specific continuum of progressive multiple sclerosis. And here at the meeting, there have been some sessions giving us some information on what some of these antigenic targets might be. Historically, we have predominantly focused on the humoral immune system in terms of being able to forestall early inflammatory disease activity. And now there are more studies that are currently happening, very rigorous and novel studies that are investigating the antigenic targets at the more adaptive immune system level, specifically astrocytes, glial cells, and microglia, both in the periphery and in the central nervous system in the brain parenchyma, to see if there is a way for us to be able to forestall some of that early progression and then later progression. And the meeting this year has been able to unfold some of that information to us, which is going to be able to identify proper antigenic targets and then the development of novel drug therapeutics for this disease progression. So what has been really interesting during this meeting is the crosstalk between epigenomics, which is your molecular cell-based science, and the ability to actually make larger lifestyle choices or the use of certain medications that can actually change the genetic makeup of an individual. So there have been some really interesting talks on how environmental exposures can actually change the makeup of our DNA, which is something called epigenomics. And then there have actually been some other talks that are more at a more global level that can speak to clinicians and patients alike about how things like social isolation can actually increase someone's risk of not only mortality, but actually leading to progression of disease later on in the MS space. So there has been a very conscientious effort to truly provide a network between what is being done at the basic science level and how we can translate that over to the bedside so we can help our patients in the real world setting.